Hi, everybody. Welcome to another podcast from XeneX. We are very pleased to have Bob Berbeco with us today. Bob is a CIO at Mahaska Health. And to start, Bob, why don't you talk about Mahaska Health, what it is, and your role as the CIO? What do you do for Mahaska?
Absolutely. So, hi everyone. I am Bob Berbeco, and I am the Chief Information Officer at Mahaska Health. And what that means is I lead organizational information technology, so servers, desktops. I also lead data science, artificial intelligence initiatives, cybersecurity, informatics strategies. And my goal, really, in my role, is to ensure that there's seamless integration between patient care or to enhance, I'm sorry, to enhance patient care and operational efficiency. So the goal is to make technology work for people. That's my personal goal as well, and to make it work very well for the people who are using the technology. Prior to Mahaska Health, I've been in a number of different healthcare technology roles. I have been a leader in all of those roles, and it's been over a couple of decades for how long I've been there. I have specialized expertise in predictive analytics, process optimization, ad car change management. I also was an operational leader within healthcare for a little bit as a service line administrator, business intelligence, data governance, experience design, demand management, and I also have a Six Sigma black belt. So I have done some operational excellence type initiatives. So beyond that, for some more, who I am. Beyond that, I also contribute to the arts and academic communities. I actually have a bachelor's in interior design. I serve on the board of directors for the Indianapolis Ballet and the Indiana University School of Science, And I actually received a Distinguished Alumni Award from the School of Science uh, and from the School of Science Alumni Association. I love and I am deeply committed to fostering collaboration, mentoring talent and emerging talent, and making a positive impact, whether big or small, both within healthcare and beyond.
Bob, with that kind of a background, we could talk for hours and hours and go over
Right.
each discipline, each topic. It could take a long time. I wish we had
It
more
could take a
time
long
than the time allocated for this podcast.
time. Sure.
But there's a lot of areas that we could talk about. But I think I want to kind of start with the question about trust, operational efficiency, data integrity, and how you mentioned something about that you're bringing technology to service your
Hmm.
patients. And what does that mean in terms of trust between um, the organization and the patients, and how do you use technology to build that and create that trust?
Yeah, no, absolutely. Great question. I think organizations struggle mostly when the technology begins to outpace the discipline around it. So as we implement what seems to happen, what I've seen happen is as we implement these technologies, the growth of it and the scaling becomes organic, and there's not a regimen behind what business need are we looking to satisfy? Does this fit within our organizational strategy? And what I've seen is the trust. So trust of the people who are using these technologies erode when the data is fragmented. Data governance is a big issue. Definitions are inconsistent. The tools, AI is a big one in this regard. The tools start to feel like black boxes. We don't know what it's doing. And then the clinicians and the physicians, they see it as a burden, or they can see it as a burden because it's not fitting within their workflow. They have workflows that already exist, and we're adding something that's yet another layer of work for them. So I've found in my experience that people trust data and technology when the information is accurate, I mean, that's key. If people don't trust the technology or the data, you're already starting flat-footed. You're going to have to bring back the trust. It has to be accessible, has to be well managed, and clearly connected to the better decisions of the front line. Uh, it may look great on paper. It may look cool in a slide deck. The technology may be whiz bang, super cool, but if it is not connected to what is happening on the front line and not serving the needs of our customers, it will lose trust, and people, they just will find ways to work around it.
Well, again, we could dig into that a lot more, but I think you said one thing that I want to talk about, of course, and there's no conversation these days that that AI does not come up, but you did mention it, and I was wondering, what are you seeing with AI today within healthcare, and what do you anticipate AI is going to do for healthcare in the near future?
Yeah, I see that AI, one of the biggest opportunities we have with AI in healthcare is where it can reduce friction, where it can return time to our clinicians and physicians, where it can improve access and strengthen decision making. It can, and there's a dark side to that. The risk happens is, when it's opaque, it's a black box, weakly governed, poorly embedded into a workflow. So here's a use case example where we're focusing our efforts organizationally is on revenue cycle. We're not like AI, and I'm sure everyone in the audience here are looking out there. There's so much buzz around AI, and it can do this, it can do that, it can do this. How we're looking at AI is a staff and knowledge augmentation. Let's plug it in. We have a process within revenue cycle that could use AI. Denial management would be a good way of applying it. And let's put this in, embed it within that process. We already have people who are doing the billing work. This AI can embed in there. It can augment the knowledge. It can make insights as to the processes that we're doing so it can learn and build upon its knowledge and share that knowledge with our billers so that ultimately the entire team, AI and the billing team, becomes this unified unit on being able to be more knowledgeable and quicker in terms of how we're managing our denials today, in terms of the appeals process, actually in terms of avoiding denials altogether as much as we can. So, and I'll step back on something. I gave a use case. The key here is don't start with the AI. Start with, from an organizational level, what is it we're looking to solve? Then decompose that into those use cases. What are some use cases where AI can show a benefit to us? Revenue cycle would be one. Clinician time back would be another. Radiology images could be another, I think, healthcare example that's been mentioned out there. And this, you'll focus on that. Then you have your use cases. Now learn what that looks like. So what are the clinicians doing? What are the billers doing? Let's see that process end to end. Okay, now how can we embed AI into that process that will benefit and augment the people that are working through that?
Yeah. That is such a good example because when I ask these questions from CISOs and
Mhm.
CIOs, I get different answers, but this was very specific about how I could be applied. I really appreciate what you said, and I do agree with you. So maybe you could talk about the challenges of AI. What do you think the downside of AI is going to be if you had a crystal ball looking at 6 months, a year or two out there?
Yeah, I think it gets back to that first tenet that I brought up is be very mindful about how you want to apply it. AI can be a very powerful tool, and you have to have governance around like guardrails around, okay, where are we going to apply it? What's our guardrails around how it's going to be applied? How are we going to ensure it's safe? How does it meet all the regulations that are out there? And make sure that we are very crystal clear about the application, what we're looking to do with it, and how it's applied. And have the guardrails, have measurement tools. There's ways. It depends on how you approach it. If it's a third party, you're going to have to embed things into your contracts as far as what it looks like and what it has access to, and the data access, those types of things. If it's something you're building within your own environment, you're going to have to be really careful. You're going to have to, and I'm not super AI technical, by the way, just letting the audience know that. So there's probably people much smarter about the aspects of what you need to do, but you want to have, contain. AI needs to be contained. We have to have it in a secure environment. Make sure it's not able to anonymously or anomalously do something that we don't want it to do. So it gets back to, sorry, just getting back to your original question. Be mindful about where it's applied, have guardrails around how it's applied, maintain and have checkpoints on the environment that it's in, what it's doing, what it's going to do, and have KPIs around how it's doing it. Is it actually making an improvement? I'll step back for just a second. Is AI has so much opportunity, and I will admit, using us as a use case, there's so much out there. So you get approached as a CIO. I get approached by a number of AI companies, and they all have great opportunities for us. It gets back to what is it we're wanting to solve specifically. And then let's look at what tool sets are out there, kind of like an RFP. Tool sets are out there that these are the things that look like RFP wise might be something that can solve that problem.
Purpose-built AI.
Yeah. Oh, see, I had a lot of blah, 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 and you just purpose built AI. That's perfect.
I've been using that term to simplify the concept because AI, for the sake of AI, does not add any value. But if you have a particular business thread that
Hmm.
can be automated, AI could be very useful.
Perfect.
Um, let's talk about compliance. Obviously, healthcare compliance, regulatory compliance is a big issue, and PCI, GDPR, HIPAA, of course,
Hmm.
they're all big within the healthcare industry. How do you see compliance impacting your role and, in general, CIO, CISO role as a benefit or as a blocker of technology and fast moving environment where technology is actually a enabler, but when you have compliance, it actually could be a little bit difficult to move as fast, but it's
Hmm.
required. How do you balance meeting the compliance, but yet move the speed of technology and also provide the benefit to the organization all at the same time?
I love it. Yeah, this is near and dear to my heart. I have so I have someone who is responsible for security. He is our security officer, and I have conversations around this. Is I love how you say balance, because that's really it. Is there's a need for security for sure. If you have the pendulum and it swings too far on the security end, it's not going to be useful for the people who are using it, or we might be stuck and not moving forward in the innovations that we need to do. If we are, going too far on this end, well, then it's risky because we've opened ourselves up to things that we probably don't want to have happen to us. So we got to stay somewhere in here. And how we approach it here is, and you're going to hear a theme around what I say and a lot of the things that I answer your questions on. Process, process, procedure, playbooks, um, all of those things, and documentation. All of those things need to be in place to help you have that guardrail around what you want to do. So on the security front, and I have a very strong partnership with our compliance officers. We have conversations because, and it's great. She will see things from a security lens, so it's going to be probably a little bit more on the on the secure side. But we have conversations around, okay, let's get more here. How do we do that? Risk analysis, risk management, risk matrix. So from an organizational perspective, let's get a good handle on what are our technology risks. What are the things that are being used at a higher level that have risks associated? What does it look like? What is the priority of the risk? What's the worst case scenario that if that risk goes live, what does it happen to our organization? So we do our best. We're human. We do our best to capture all of that for the organization. Within those, we will decompose those risks so that we have a better understanding more at a in the roots type level or closer to the action type level. What is the risk associated with some of these larger ones, and what are some checkpoints that we need to do to make sure that we're kind of checking off on those different risks. And I'm going to sing the praises of the person who's my security officer. He's awesome. He's very good at he's very methodical about doing that. So large opportunities and risk decomposed into these little action items. All these little action items that we have. We have HIPAA. We have NIST. All he probably can cite all the ones better than I can, but we have all of these regulatory bodies. Let's make sure that we're doing the check boxes to make sure that we're as secure as possible in our environment. The technology is secure too. That's how we are approaching it today.
And that's a great approach to do this because all those controls within these compliance, such as NIST and HIPAA, allows you to really. I love the answer because when you go narrow on a particular issue, you can find a solution for it. But when you talk about it as wide as it is, then it's very difficult to come up with a solution. So, what are the challenges that you see in healthcare in your organization as it relates to um, security, cybersecurity in healthcare, and keeping up with all the challenges that come with ransomware and
Mm-hmm.
breaches, the data privacy? There's a whole slew of
Mm-hmm.
things
Mm-hmm.
that we can talk about, but in general, those what are the challenges and how do you address those challenges?
You're right on. Security and keeping things secure is a very difficult thing. We'll see every day a large organization, medium sized, small organization being exposed somehow through some different vector of whether it's ransomware or just manipulation of the environment. We see that every day. And it's tough. So how we're approaching it is kind of more of a two-prong approach. So the first prong is what are all the things that we can do as a technology entity and focused on security to secure, lock the box on our environment as best that we can. And and I get back to the risk matrix on this is you know, document. You really need to document the risks that you have in your environment and have action plans associated with how we're going to reduce that. We also have external third parties that measure us. So we do, some of the standard playbooks for security is pen testing. We do that. We have security scorecards that monitor our environment and give us opportunities that we need to look for. We do have a third party continuous monitoring SOC, external SOC system that also is monitoring and making sure that we're on point as far as any exposures, active exposures, or maybe there's something that we missed in what we're looking to do. Another thing, this is further out, so I'm still on the first prong. Further out is we are working towards a zero trust environment. And that's going to be, it's a strategic plan of ours. There's some uh, tactical touch points that are going to be part of that. but we're really working towards this as best we can to have our environment set up as zero trust. Now, on the other prong, education. So what can we do? People aren't going to, I mean, they don't want to give their credentials to someone. I mean, they're not, I'm trying to think how to say this. It's like they're being socially engineered to give their credentials to people that they really wouldn't, but somehow they've been manipulated to do that. That's not the fault of them. There's no blame associated with that. We're all human. We all make mistakes. Where we can help is let's educate them. Because not only are they getting attacked at home, I'm sorry, attacked at work, they're likely getting attacked at home. So the same education could apply not only for making sure that we're secure here, but the people that work for us, we can help them to make sure that their lives are secure outside of work. So we do a lot of education, specifically on phishing. Phishing, I think you're in the, you probably already know this. Phishing is the most popular vector of attack.
Yep,
Most
it
of
is.
the
It is.
organizations that have been ransomware, that was the vector attack, was phishing. And we get hit, we get the phishing, the schmishing, the phone calls, we get all of these things, people trying to do something. And we educate, educate, educate everyone in the organization. I realize I'm a small organization. And I should have mentioned that. We're a critical access hospital, by the way. We have 720 employees, about 90 plus physicians. I've given my cell phone number to everyone that I can within the organization because IT is accessible. If you have questions, you get an email, please reach out to us. We'll continue to actively educate. We do all that. We actually have education programs. We have online education that goes to them. We have tests done monthly, and then there's follow up on those tests. We have leaders watching those to make sure that their people are doing what they should be doing. So we're doing the best that we can to educate people and it be accessible. Is to answer people's questions as they come up.
Um, that's, I love the fact that you said something IT accessible. This
Mm-hmm.
is a key component. What I
Mm-hmm.
think is a lot of organizations treat IT as a separate entity, kind
Mm-hmm.
of speak,
Mm-hmm. Mm-hmm.
isolated, and there's always a gap. What are these guys doing? Why don't I understand the process?
Mm-hmm.
Why don't I
Mm-hmm.
understand you know, what they're telling me just doesn't fit into how I
Mm-hmm.
work, and they're making it harder for me. They're, putting MFA on my account. I don't want to use
Mm-hmm.
it. So there's always
Mm-hmm.
these issues that
Mm-hmm.
we want to be more secure. We want to make our organizations more secure, yet the users find it more harder to do. So, having said that, in terms of security and how all these telemetry that we pick up from a variety of sources, how how much alert fatigue do you see in the system? What is the role of security operations center or SOC in the environment, and how do you marry the SOC, which is an external organization, to your internal communication, so that there's a lot less friction with those users and have a very smooth, seamless operation?
Mm-hmm. Yeah, great. Another great question. I think it comes down to partnership. Whoever you're bringing in as your external SOC, one, um, do your best to ensure that they understand your needs from the onset, and have active communications with them on if there are alerts and there's alert fatigue that is happening, how can we filter and tweak that so that those alerts aren't coming up as much. I would say from my experience here that we have a engineering team, and in addition to the people who, or in addition to my security officer, and in talking with them, it seems like we've struck the right balance. We're getting some alerts that are, I don't want to say useless, but informational, but it's kind of a false alert. We still get some of those, but in talking with our external partner, they've been helpful. They listen. So when we talk with them, we look to filter those a little bit better. Other things too, I think we talked about AI. AI and a benefit of AI is it can take autonomous actions based upon some of the alerts that are happening. So some of the alerts that we get, there's a suggested, we want human in the loop of validation before something just gets turned off, so we have that. But the automation piece of it will make a suggestion and basically seek for a confirmation that this is what we want to do. So
Yeah.
getting back to your question though, it's really having that partnership with the external SOC is going to be paramount to getting the right balance.
Yeah. One of the things that we are doing and we're seeing is that not only it's the detection, but also the taking action automatically based on certain policies.
Hmm.
So
Hmm.
you could
Yeah.
automate it to the point that you reduce the number of alerts that are quote unquote not critical. So you address the majority of those alerts automatically, autonomous response,
Hmm.
while you address some of the critical ones in a collaborative environment with with the organization, so that you could you don't shut down a patient portal unnecessarily. You don't
Hmm.
shut down the billing system because something happened, that you actually dig into it a little bit further because the appropriate action is taken. So some of those are, very well said, Bob, but it's really understanding how you
Hmm.
go from one side to the other side, knowing all the elements, what's in the process, and what pieces of those process are being handled by whom. So having said that, there is still a lot like deep fake with AI coming up, and
Hmm.
has
Hmm.
already come up,
Hmm.
and it's very challenging as CISO,
Hmm.
CIO of a
Hmm.
healthcare organization. What challenges do you see as it relates to cybersecurity over the next, let's say, 12 months? Because it's changing very fast,
Yeah.
and we're all facing it. But what is your perspective on that?
My perspective is it gets back to education. So we'll do everything we can. It's like a AI war is happening now. So the bad guys are using AI to get in. We're starting to use AI to keep them out. And so you're going to have this almost Cold War effect of us building up our armaments. I really, for me, I think education is a key, is as these new things, as these new vectors, as I think the deep fake, you mentioned deep fake. I mean, as these things come out, we as security people need to be proactive in how can we educate people so that they don't get faked out by those things. Because I, I really believe like the human piece of this is going to still be that vector of attack. That social engineering is still going to be
Yeah.
a pretty large component of it
And for our
with
audience,
AI.
yeah, I think they're actually, because of the deep fake, there's no new, for the benefit of our audience,
Hmm.
there's new technology that allows us to automatically with AI look at the phishing attacks and
Hmm.
actually provide automatically the right training for each
Hmm.
individual. So quote unquote individualizing the training and understand education, so that it's more specific, because obviously a finance team is going to get a very different deepfake attack than IT does, than operation does. So there's technologies there that really are helping uh, uh, reduce the risk there, or hopefully eliminate it. But like you said, it's a cold war in AI.
Hmm. Yeah.
We keep going and we keep going, but the good news is that the industry as a whole, cybersecurity industry as a whole, is creating tools that can help accomplish better posture, defensive posture, as we move forward. So uh, I want to talk about the role of your role in general, or role of CISO, CIOs, and the board. And obviously, you know, maybe not that obvious, but the role of CISO, particularly as it relates to cybersecurity, has changed. It's no longer an IT issue, it's a business issue. And the transition has come because of the attacks, the breaches, and every organization, particularly
Hmm.
healthcare, they want to protect their organization. They don't want to be in the headlines in the news like we did. One of the largest healthcare breaches happened 2 days ago. Uh,
Hmm.
and nobody wants that bad publicity. How do you communicate to the board, and how do you get support from the board level members to take on new initiatives to support the
Hmm.
organization while balancing budget and cost versus benefit, and obviously sometimes the conversation about cybersecurity and the needs of a cybersecurity becomes really complicated at board level because
Hmm.
they're not technical people, typically
Hmm.
speaking. Therefore, there has to be a bridge. There has to be a communication bridge that says we need this because it does this. So I want you to kind of tell our audience what that means from your experience and how they should be talking to their board in order to make it easier for the board to understand and support initiatives that help the organization protect themselves, because it's all comes down to budgets and more resources.
Yeah. No, you hit on an important point. I mean, IT is typically not a revenue generating unit. It's a production unit. So how do you approach the board to ensure that they understand what you're needing to do and the cost implications of it? I take a disciplined approach with this. One is, and this may go without saying, but one is and I do this with others, anticipate your audience. Try to implicitly understand, put yourself in their shoes. What do they want to know? So, what is it? So what? Why do we need it? Now what? What's the next step? I really try to frame it in those types of terms so that they have a good understanding and are able, it's about decision making. So I want to make sure that my decision makers have the right framework to make an informed decision. I can go either way, in a way I mean I know what I want, but I could go either way in a decision. I just want to make sure that um, I frame it in such a way, and I think I mentioned the what, so what, now what. I frame it up in that way is here's what it is. Here's what it can do. Here's what we're attempting to stop from happening. And the so what would happen? So here's the pros and cons. Pros, cons, cost. Pros, tighter environment. Cons, cost. And then from there, decompose it a little bit. Here is what could happen. Not to scare people. It's not to scare people because that's scary. But it's not to scare people. It's more around decision making. Is
Yeah.
okay if we do this. You do an analysis. If we do this, this is what we gain. This is what it would cost. If we do this, this is what it is. If we don't do it, that's okay. I mean, could be okay. Just here's what it does. Here's our risks. Gets back to the risk matrix. Here's our risks and put it as simply as you can. And my interactions with the board, different boards actually, different organizations, is try not to get technical. Just put it in a way where at a high level we're doing this. This is the risk associated with not doing it. This is what it would cost. Here's my recommendation and why, in terms that they would understand. That's my advice.
Yeah, 100%. 100%. And that's my advice as well. Don't get technical. Explain the pros and cons, the benefits that it brings in, the costs associated, and what are the consequences if you don't
Yes.
do it. They need to understand the consequences. Um, I think we have time for one more question, although I could stay on this podcast for hours because I've got so many interesting topics and questions that we could go on
Sure.
for a long time, but unfortunately, we don't have the time. So, this is my last question for you. IoT, obviously, healthcare devices. Any healthcare organization has many, many devices for healthcare that are embedded operating system, embedded code, and they connect with internet, right? Therefore, exposing the attack surface from you know a variety of locations and functions and services. How do you manage that, and how do you protect that? It's an ongoing battle, but you don't
It
know
is.
what's inside that IoT.
Hmm.
In the
Yeah.
case of healthcare, medical devices that are sitting in the hospital or and people are using it.
No, you're right. You are right on. And sometimes those companies that have those medical devices um, get exposed, right? They get hit by something, and now all of a sudden, oh boy, we got all their things in our environment. What kind of a risk does that pose? That is a excellent question. The other piece of that risk too is that in many organizations, those devices typically don't come through the IT pathway. They come through like a clinical engineering or other pathway to where maybe IT doesn't have exposure to it. So, so I would say and it'll be an ongoing battle. I don't think any organization is 100% on this. It's going to get back to process and how you need to modify or optimize your supply chain so that IT has visibility into these things that are coming in. Not only visibility to what's coming in, but visibility to what's already out there so that we can put together our risk plans around, hey, we got these devices out there and let's ensure we capture that within our organizational risk matrix and ensure that we're aware of those because I think awareness is really the big thing. It's knowing they're out there first, and then doing your best to tighten the ship on ensuring those things aren't exposed in the best way you can.
Yeah,
But
yeah.
that's a toughie. That's that's the tough one for sure for healthcare.
Yeah, it is. And again, technology can help, and there
Hmm.
are tools that actually look
Hmm.
at
Hmm.
the traffic that's
Hmm.
going in between, and if there isn't suspicious traffic between those
Hmm.
devices,
Hmm.
it's a signal that hey, something is not right with that IoT device or medical device that's doing something weird that it's unexpected. So there's actually tools. Bob, I can't thank you enough for your insights and leadership and sharing your leadership experience and how to do things with our audience. This was a great conversation. As I said before, I really wish we had more time to continue this conversation, but hopefully we'll bring you back in one of our future podcasts so that we could say, okay, this was 6 months ago. What's happening today? Because we know it's changing very fast. So thank you very much for
Absolutely.
joining us today.
You're welcome. It was my pleasure. I appreciate the opportunity.
All right, then. We'll talk to you later. Okay.